Well, with the explosion of obesity, diabetes over the last 30 years, not to mention the explosion in related health care costs as a result, our next guest says it's time to get involved using the tax code. Specifically, tax the foods that make people sick and subsidize the food that makes people healthy. Those are scientifically answerable questions. Things like greens, vegetables, dried legumes, fruit should be subsidized. Junk food taxed. In a recent column for the New York Times, Mark Bittman says that heart disease, diabetes, and cancer are all linked to the so-called Standard American Diet, or SAD, for those of you following along at home, and that it's time for the government and all of us collectively to take the stand for our public's health, for our own well-being, both physically and financially. Our healthcare costs are out of control. Here to break it down, New York Times columnist and author of How to Cook Everything, Mark Bittman. Your argument is that the tax code should be utilized to to help create more incentives to be healthy.
It's like, do you want to use taxes to help people, or you want to use taxes to hurt people? It seems to me right now we're doing just about everything wrong, at least when it comes to food.
Explain.
Well, we're directly subsidizing the crops that produce junk food, bad meat, hyper-processed food, and we're not subsidizing the foods that we know make us healthy. So as a result, we have increased healthcare costs, we have increased heart disease, diabetes, and so on down the line. I mean, these are real contributors to the debt problem, as we know. And we have people leading sick or sicker lives than they need to be leading.
And what you're referring to when you say the subsidy, you're talking, I presume, explicitly about the massive corn subsidies that exist inside of the American government right now.
Well, I'm talking about both direct subsidies to corn and soybeans, which are used to produce mostly junk food. Talking about indirect subsidies, because we all pay each other's health care costs, and the sicker we are, the more we each are paying for that. And we're ignoring the costs to the environment that these kind of crops are creating.
So it all makes sense to me. One thing strikes me as a critical problem in your theory. If I want to raise money to run for president, I have to do well in the Iowa primaries. If I don't do well in the Iowa primary, I cannot create the optics of momentum that allow me to go to other states in order to accumulate the funding to move forward. In order to do well in the Iowa primary, I must be in favor of corn subsidies.
Well, it's a problem. I mean, I agree it's a problem. I'm not a political analyst, but there actually are farmers, Farm Bureau representatives, even big farmers who now think, look, let's just do without these corn subsidies and let's grow our crops and make money the way farmers have made money before. We encourage nobody to grow vegetables. No one in this country is being encouraged to grow vegetables, and everyone in Iowa especially, which I read today, by the way, grows more grain than Canada. I mean, that's incredible.
Well, we subsidize it. That actually is evidence that using taxes and subsidies works.
We know that this works. As I said at the beginning, what we're doing is doing it all wrong. We're not using tax policy to help people. We're using tax policy to actually make people sick.
One other issue with your crazy idea.
Crazy, isn't it?
How is it that the food industry and the meat industry and the sugar industry can make as much money as they do if they don't have the benefit of those corn subsidies, one? Two, how is it that the drug industry, health insurance industry, and fee-for-service doctors can make as much money as they do if people who do not have diabetes and are not sick from all the sugar they're eating?
Well, why is that my problem? I don't care whether those people have huge profits
but
or not.
But those people do give political contributions to politicians who ensure a rigged tax code that keeps them profitable and you sick.
Well, you know, that's a discussion about how ordinary people are able to exercise power in this country. It's obviously a different and more complicated discussion, and one I'm sure you have all the time. I can't answer that in 30 seconds.
But I kind of bring it up.
It is a problem.
Rhetorically,
clearly, yeah.
Just because I guess the reason I even bring it up, and we'll wrap this, is because your idea is very rational, brilliant, totally engaged. It's pretty simple.
Well, as is creating jobs for people who need jobs, and you can't get that done either.
Right. I like the idea. Mark Bittman, and I am one of 300 million people who now likes that idea in this country. So we can
there we go. There's at least two of us.
Mark Bittman, New York Times columnist, author of How to Cook Everything. Do check it out. We'll also get that up on DylanRatigan.com a little bit later tonight, so you can check it out there, along with all over the Google and, of course, at the New York Times.
A pleasure.
Yes.
Thank you,
Mark.